The symptoms and signs of ovulation vary from woman to woman. Some women feel their impending ovulation precisely, for others, these signs are more difficult to perceive. The symptoms of ovulation, once identified, allow any woman to maximize her chances of getting pregnant. Symptoms and signs of ovulation, why you should know them. The symptoms of ovulation are sometimes difficult for a woman to determine. Knowing how to recognize them is very important because it also allows you to identify your peak of fertility and therefore to maximize your chances of getting pregnant. Ovulation occurs 14 days before the start of your period. Once there is ovulation, it is the moment for the couple to procreate. Depending on each woman, the ovulatory period varies. It all depends on the length and regularity of the menstrual cycle. Symptoms of ovulation in practice. The symptoms of ovulation are clearly identifiable. 1. Breasts are more swollen during ovulation. As ovulation approaches, any woman may experience tension in the breast and swelling of the breasts and sometimes sore breasts. 2. Increase in body temperature as a sign of ovulation. Other symptoms of ovulation include an increase in body temperature of a few tenths. Then this temperature will remain in a plateau for 12 to 14 days before falling again. This sign is often identified by the fact that we will sweat more than usual and that at night, more particularly, we will be hotter than usual. The temperature curve is an easy method to track her ovulation. You can make your temperature curve online to help you conceive a baby. 3. Pain in the lower abdomen, a common symptom of ovulation. Some women have pain in the lower abdomen, often lateralized, on the side where there is ovulation. The pain would be caused by the expulsion of the egg. 4. Enhanced libido. Ovulation is also manifested by an increase in libido. 5. Modification of the cervix. The change in the cervix is also a sign of ovulation. It becomes indeed open and soft, high and straight. To check this, you just have to slip a finger into her vagina while squatting to make sure your cervix is open. Sign of ovulation: cervical mucus that looks egg white. Another symptom of ovulation is the observation of cervical mucus. During the ovulatory period, the famous cervical mucus becomes stringy with an egg-white appearance. Stretchable between two fingers, it is then the sign that it is necessary to procreate without further delay. This symptom of ovulation is also at the heart of the Billings method, a natural method of contraception. Right before ovulation, some women experience an increase in sebum secretion, are more hungry and feel heavier on the scale due to water retention, or have a larger waist circumference. In the estrogenic phase, women claim creativity and good humor, while in the progestational phase, they say they are more irritable. Symptoms of ovulation and their actual measurement. If all the signs mentioned above are random from one woman to another, the ovulation test remains. Ovulation tests are an alternative for those who are unsuccessful in determining the symptoms of ovulation. Before an egg is released, the luteinizing hormone or LH surge is usually reached 24 to 36 hours before. This is what the famous ovulation test will measure. In conclusion, knowing your own ovulatory symptoms is very important when preparing to conceive a child. In addition, observing these symptoms is an excellent way to know your body and its evolution, and why not, to adopt a method of natural contraception.